À tous, bienvenue à cette conférence de presse avec le ministre de la Santé, Jean-Yves Duclos, l'administratrice en chef de la santé publique, Teresa Tam, et le sous-administrateur en chef, Howard New. Cette conférence se déroule via Zoom, so if you have questions, you may want to raise your hand right now so I can come up with a list for question period. Donc, on va commencer avec Monsieur Duclos. À vous la parole.
Bien, merci beaucoup et bonjour à tous et à toutes. Good morning, everyone. Il me fait évidemment grand plaisir d'être avec vous aujourd'hui, quoique en mode virtuel, avec mes collègues, la Dr Tam et le Dr New, qui se joignent à nous. First, I'm pleased to provide you with the latest data on vaccination. As of January 30th, which is just therefore last Sunday, 85% of all Canadians had received a first dose. 79% of all Canadians of all ages had received 2 doses. And among those eligible, 50% had received an additional booster dose, which is an increase of 5% compared to the earlier week. Also, nearly 55% of children aged 5 to 11 had received at least 1 dose. That's an increase of 2% compared to the earlier week. I obviously encourage all parents to get their eligible children vaccinated. The Health Canada website actually has lots of useful information on pediatric vaccination, including a series of Ask the Doctor videos, which can help parents, us parents, make the best informed decision for our children. En date du 30 janvier, 85% des Canadiens de tous les âges avaient reçu au moins une dose de vaccin. 79% des Canadiens de tous les âges avaient reçu 2 doses de vaccin. Et parmi tous ceux et celles admissibles, 50% avaient aussi reçu une dose de rappel additionnel, ce qui représente une augmentation de 5% par rapport à la semaine antérieure. Près de 55% des enfants âgés de 5 à 11 ans avaient aussi reçu au moins une dose, ce qui représente une augmentation de 2% par rapport à la semaine précédente. J'encourage tous les enfants, tous nos parents, évidemment, à faire vacciner les enfants de 5 à 11 ans. Il y a beaucoup d'informations utiles sur la vaccination pédiatrique, incluant une série de vidéos intitulées « Demandez aux médecins » sur le site de Santé Canada pour nous aider comme parents à faire les meilleurs choix concernant nos enfants. Je remercie aussi tous ceux et toutes celles qui ont retroussé leurs manches et qui continuent à retrousser leurs manches pour choisir de se protéger et de protéger ceux et celles qui nous sont chers. The COVID-19 pandemic has reinforced the importance of nurses in our health system. Now, more than ever, is a time to ensure their perspective, the perspectives of nurses, and their experiences have to be more integrated in our decision-making. That is why last week, Health Canada began a process to hire a chief nursing officer. A successful candidate will not only represent the interests of nurses at the national level, but will also contribute to the important healthcare policy work that Health Canada needs to do ongoing. I encourage all qualified candidates to apply, and I look very much forward to greeting the new Canadian nursing officer later this spring. La pandémie de COVID-19 a renforcé l'importance cruciale des infirmières et des infirmiers dans notre système de santé. Maintenant, plus que jamais, il est temps de garantir que leur point de vue et leurs expériences soient davantage entendus et pris en compte dans les décisions que nous prendrons et que nous prenons à l'échelle du pays. C'est ainsi que cette semaine, Santé Canada a lancé un processus pour l'embauche d'une infirmière ou d'un infirmier en chef. La candidate ou le candidat retenu représentera non seulement les intérêts importants des infirmières et des infirmiers à l'échelle nationale, mais contribuera également de manière substantielle aux travaux et aux décisions qui vont devoir continuer à Santé Canada en matière de protection de la santé des Canadiennes et des Canadiens. J'encourage donc l'ensemble des Canadiens et des Canadiens qualifiés à postuler et j'ai bien hâte d'accueillir la nouvelle infirmière ou le nouvel infirmier en chef un peu plus tard ce printemps. Case counts have been decreasing in recent weeks, but hospitalizations and ICU remain at a very high level. It therefore continues to be important to limit the spread of the virus as much as possible. We have to remain prudent. Individual efforts, that is the efforts of every one of us, including the layering of personal protections, are helping to slow transmission and help also mitigate severe illness across Canada. I'll say it again, we'll say it again. Vaccination is one of the most effective ways to protect ourselves against severe disease and transmission of COVID-19. If you have not already done so, I urge you to take this important step to protect yourself and to protect the health of those around you. Bien que le nombre de cas ait diminué dans les dernières semaines, le nombre d'hospitalisations et de gens que l'on retrouve dans les unités de soins intensifs demeure très élevé. Et nous devons donc continuer de mettre en œuvre tout ce que nous pouvons faire pour limiter la propagation de ce virus autant que possible. Il faut continuer à être prudent. L'utilisation de mesures de protection personnelle et d'autres mesures nous aident à ralentir la transmission et les incidences de cas graves. Je le répète, et on le comprend, mais toujours important de le redire, la vaccination est l'une des mesures les plus efficaces pour nous protéger contre la transmission et l'incidence de cas graves de la maladie suite à une infection à la COVID-19. Si vous n'avez pas encore reçu une première dose de vaccin, je vous encourage à le faire pour vous protéger et protéger toutes celles et tous ceux qui vous entourent. Merci. À vous, Dr. Tam.
And bonjour à toutes et à tous. This winter, unprecedented numbers of people in Canada have been infected with the highly contagious Omicron variant. Though declining, daily new case counts averaging over 10,000 daily, together with other indicators of COVID-19 disease activity, including test positivity, RT, or the effective reproduction number, and wastewater surveillance trends, indicate ongoing widespread activity across the country. Presently, severe illness trends are elevated or still rising in many areas of the country. Up to February the 2nd, an average of over 10,000 people with COVID-19 were being treated in hospitals each day, including over 1,100 in intensive care and over 140 deaths were reported daily. As we continue to take measures to mitigate the impact of COVID-19 and protect our heavily strained health system, experts are learning more every day about the effectiveness of COVID-19 vaccines. At the same time, we are moving ever closer to more and better treatments. These advancements will help lighten the load that so many of us have been carrying in the space between us and through the difficult sacrifices we've made. Since the outset of COVID-19 vaccination programs, Canada's National Advisory Committee on Immunization, or NACI, and health authorities across the country have continued to monitor vaccine safety and effectiveness data. What the latest data show is that while 2 doses of COVID-19 vaccine offer reasonably good protection against severe disease, receiving an mRNA booster dose offers superior protection, keeping more people out of hospital or preventing more deaths. In general, data show that protection against hospitalizations is over 90% with an mRNA booster dose, which is 15 to 40% higher effectiveness than with just 2 doses. There are many benefits of being fully up to date with COVID-19 vaccines across all eligible age groups. Protection ranges from the smaller and shorter duration against infection through a somewhat larger reduction in symptomatic illness to strong protection against severe outcomes. Given the very large number of Canadians with a confirmed or apparent infection during the Omicron surge in particular, it is also important to highlight that previously infected people benefit from starting or completing their COVID-19 vaccination. Hence, for the best possible protection against severe illness now and going forwards, health authorities continue to strongly recommend up-to-date COVID-19 vaccination for all eligible people, including for those who have had a COVID-19 infection. Today, NACI is releasing updated recommendations on suggested intervals for administration of booster doses for those who have been previously infected. Notably, NACI suggests that an mRNA booster be given at least 6 months after the previous dose or 3 months following infection, whichever is longer. However, as no vaccine is 100% effective, it is important for everyone to continue to use personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces. For the many hard-won advancements that would not have been possible without the collective efforts of countless Canadians, thank you, merci, Megwij.
Bonjour à toutes et
Good day. This winter, unprecedented numbers of people in Canada have been infected with the highly contagious Omicron variant. Though declining, daily new case counts averaging over 10,000 daily, together with other indicators of COVID-19 disease activity, including test positivity, RT, or effective reproduction number, and wastewater surveillance trends, indicate ongoing widespread activity across the country. Presently, severe illness trends are elevated or still rising in many areas of the country. Up to February 2nd, an average of over 10,000 people with COVID-19 were being treated in hospitals each day, including over 1,100 in intensive care, and over 140 deaths were reported daily. As we continue to take measures to mitigate the impact of COVID-19 and protect our heavily strained health system, experts are learning more every day about the effectiveness of COVID-19 vaccines. At the same time, we are moving ever closer to more and better treatments. These advancements will help lighten the load that so many of us have been carrying in the space between us and through the difficult sacrifices we've made. Since the outset of COVID-19 vaccination programs, Canada's National Advisory Committee on Immunization, or NACI, and health authorities across the country have continued to monitor vaccine safety and effectiveness data. What the latest data show is that while 2 doses of COVID-19 vaccines offer reasonably good protection against severe disease, receiving an mRNA booster dose offers superior protection, keeping more people out of hospital and preventing more deaths. In general, data show that protection against hospitalizations is over 90% with an mRNA booster dose, which is 15% to 40% higher effectiveness than with just 2 doses. There are many benefits of being fully up to date with COVID-19 vaccines across all eligible age groups. Protection ranges from smaller and shorter duration against infection through a somewhat larger reduction in symptomatic illness to strong protection against severe outcomes. Moreover, those who are eligible a booster can decrease your risk of infection, which can in turn reduce the likelihood of spreading the virus to others. This is one way that being up to date with your vaccination provides an additional benefit of indirectly protecting others in your family and community. This can be especially important in helping to prevent infection of seniors at high risk and others who may not mount a strong immune response. It is important to keep your vaccines up to date. Today, NACI has updated its recommendations. when expectant and new parents, as well as their households and close contacts, are fully vaccinated, indirect protection can help reduce infection that could lead to potentially severe outcomes in pregnancies, newborns, and very young children. As no vaccine is 100% effective, it is important for everyone to continue to use personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces. For the many hard-won advancements that would not have been possible without the collective efforts of countless Canadians, thank you. Merci. Miigwech.
Merci beaucoup à tous.
Thank you very much.
We'll go to questions. You know the drill. One question, one follow-up. J'ai fait une liste en tentant d'alterner le français et l'anglais et ainsi qu'en respectant l'ordre du premier arrivé, premier servi. Ce qui aide aussi.
First come, first serve. I think what would be helpful if you had the proper microphone for interpretation, it is easier for the interpreters to hear you and for them to do their work. We'll start with Pierre Saint-Arnaud from the Canadian Press. You have the floor, Pierre. Go ahead. Dr. New, my question is for you. In Quebec, we've heard that there's been a drop in hospitalizations, a drop in intensive care, but the expectation is that there might be a rebound, a climb in February. Can you tell me what provinces are still seeing this rise? And in those provinces where there been a drop, can they also be expecting another rise? Answer, thank you for the question. That's a good question. It's difficult to answer because Canada is a large country and every province and territory has its own situation as to what's going on in real life. I can tell you that with our counterparts in the provinces and territories, everybody has been really closely monitoring the epidemiological data out in the field, and everyone is prepared to adjust public health measures when required. Everyone's done. Everyone's tired. So am I, given what's happened with COVID-19. Everyone wants public health measures to be loosened, but we're seeing, and we've seen with previous waves, that there is a balance that needs to be struck. If you do away with public health measures too quickly, then there's always the risk of creating more hospitalizations, more potential deaths. I think really it is important to continue with the vaccination effort, increase vaccine coverage. Everybody has a personal responsibility to take individual protective measures, wear a mask that is well adjusted to their faces, that's a good quality mask. Aside from that, it's really up to local authorities to take a look at what's going on. If we loosen the rules, then that means that you might eventually have to, in certain cases, reinstate some measures. It's difficult to predict what will happen if we loosen some of the rules at this point, some of the measures. We are watching these incidence reports. This is not a second question, but could you give us an overview of the provincial picture? But my second question is this. We're seeing BA2, which is an Omicron subvariant. What do we know about the three most important characteristics? How virulent, how resistant it is, and how contagious it is? How much does it resist the vaccinations that we currently have in place? Answer. To answer your first question, I think it's interesting. It's interesting to see under the Omicron wave, the largest provinces, Quebec and Ontario, started with their own wave before the other provinces and territories. So we can see what's going on in Ontario and Quebec. Perhaps we've already hit the peak of these number of cases. But now we have to take a look at what's happening with the rates of hospitalization and deaths. These are always lagging indicators, and we can take a look at what's going on in other provinces. Perhaps later on, perhaps they have not had the same experience as Ontario and Quebec. That's the answer to your first part of your question. But about BA2, the Omicron subvariant, we detected the first cases in Canada. Actually, retrospectively, we noticed a few cases in November. But with sequencing and sampling in our labs, we can see that it represents about 8% of the reported cases that we've sequenced. So there you have it with the three questions. Now, as to preliminary data, it is possible. BA2 the indications seem to be that BA2 is more contagious than the BA1 original Omicron variant, but we don't have enough information or data to tell us if it's much more severe in terms of an illness, and also as to the vaccine effectiveness. We can't say that we've seen a massive change in the effectiveness of vaccines versus BA1. We'll continue to be monitoring this. Of course, every variant requires us to maintain our collective effort. Vaccination, first and foremost.
Merci.
Et sur la question des hospitalisations, Pierre, on va s'assurer que vous obteniez les réponses les plus à jour possibles avec l'équipe de communication de la santé publique et la mienne.
Merci. Rafi Boudjikanian, CBC News, you're up. Rafi?
Sorry, was I muted still?
Okay, you're good.
Okay, thanks. My first question is for Minister Duclos. You promised 140 million rapid tests would be delivered to the provinces in January. We know some are reporting numbers that are much lower than that. And so where are the rapid tests?
Thank you. So let me first provide a higher overview for those that maybe didn't follow the whole context. So we know that even prior to Omicron, the use of rapid tests was not only underestimated, but the value, I think, was probably misunderstood. And that's why for some months, and a large number of months, in fact, in 2020 and 2021, there was a relatively modest demand for rapid tests on the part of provinces and territories. That's not a blame, it's just a statement. When we started to see Christmas coming early in December, we worked with provinces and territories and multiplied by 5 the average number of rapid tests that had been delivered to them prior to December, which was about 7 million rapid tests, multiplied by 5. So we were able relatively quickly, and perhaps surprisingly for some, move to 35 million rapid tests delivered in December. And then with Omicron, obviously, we saw quickly a much larger demand for rapid tests, not only in Canada, but internationally. So we committed to delivering 140 million rapid tests, so multiplying by 4 compared to December, the number of rapid tests delivered to provinces and territories in January. Now, the remarkable news is that we were able to secure and have 140 million rapid tests arrive by the end of January in Canada. That was obviously an immense struggle. We were competing with many other countries which had identical needs and requests. So despite this immense pressure on supply chains, we were able to have 140 million rapid tests by the end of January, that is by January the 31st. The majority of these tests have been delivered prior to the end of January to provinces and territories. Many of them have been delivered since Monday, since January the 31st, but there are more tests arriving to provinces and territories in the next few days, so that at the end, as we have promised, 140 million rapid tests will have been delivered. I will end by saying that we took stock of that outcome and the challenges related to it with my colleagues, health ministers. Just yesterday, we had a meeting, all of us together, to see where we are, to celebrate the arrival of these millions of rapid tests, but also to recognize that we need a lot more predictability ongoing with the actual timing of those rapid tests as the situation evolves.
Thank you. And my follow-up is for Dr. Tam. Some provinces like Saskatchewan and Alberta are moving quickly to remove restrictions despite high hospitalization rates. Is that happening too quickly?
Well, I think the provinces are in the best position to judge that because they have different health system capacities. So it is a very difficult balance to do. So I think that's the challenge ahead of the provincial response. I do think that prior to vaccinations, prior to getting some more treatments, and of course some immunity afforded by Omicron, that balance was very, very difficult to achieve. And I am, optimistic that it will become easier to achieve that better balance. However, we know how fragile health systems are. So I think at the provincial level, they will have to do their own assessment of that. It's difficult at the federal level to be able to make that call.
Boris Proulx, Le Devoir.
Question from Le Devoir. Good day. In the same vein as the previous question, earlier this week we heard the Freedom Convoy asking for an end to all public health measures. My questions are for the doctors, but Minister, you might also want to add something. What would be the consequence on the state of things in the pandemic if Canada were to drop all public health measures at this point? This is Dr. New.
Quelque chose effectivement à la fin. Oui, OK. Oui, merci.
Yes, thank you, Minister. We know what needs to be done with public health measures. Even personal protective equipment, this is well-known information. We just have to keep doing what we're doing. We've seen with these previous waves what can happen. If there's an increase in contact among people who might be vulnerable, susceptible to the infection, then vaccine coverage, or in some cases vaccine coverage, may not be high enough in some populations. We know exactly what needs to be done. We have the tools in our toolbox. We have these vaccines. Now we have some treatments and the necessary measures to reduce the risk of exposures. So it's not a good idea, I don't think, to do away with public health measures too quickly. We do need to be cautious in our approach and maintain a lot of flexibility to do things when necessary. If we look at the scientific perspective, at least, it's unquestionable. It's a matter of finding the right balance.
Et j'ajouterais tout simplement qu'on ne peut pas être à la fois contre la vaccination et contre le confinement. La seule façon d'éviter le confinement, de s'assurer qu'on retourne à une vie plus normale, c'est d'être pour la vaccination. Donc, ceux et celles qui militent à la fois contre la vaccination et contre les confinements, malheureusement, ce n'est pas compatible, ça ne fonctionne pas. On a vu avec une très grande joie au cours de la dernière année, la science et les scientifiques nous amener des vaccins. On sait que normalement, ça aurait pris, là, il n'y a pas longtemps, une dizaine d'années à la science et aux scientifiques de produire, pour lutter contre la COVID-19, certainement des vaccins. On a fait ça avec la science en moins d'une année, ce qui est extraordinairement remarquable. On a en plus eu la chance au Canada d'être un des pays les mieux vaccinés grâce au processus d'approvisionnement qu'on a mis en place et grâce aux efforts que les Canadiens, la grande majorité des Canadiens ont fait. Heureusement qu'on a eu cette chance scientifique et ce travail des Canadiens parce qu'on serait présentement avec Omicron dans une situation extraordinairement difficile. Ce qu'on voit comme mesure de confinement, le couvre-feu au Québec, les fermetures, tout ça, là, ça aurait été de la petite bière par rapport à ce qu'on aurait eu besoin de faire en l'absence de cette chance que nous avons eue de vacciner autant de Canadiens. Donc, être contre la vaccination et contre les mesures de santé publique, ça n'a pas de sens. La seule façon, c'est de continuer, et la Dr Tam et le Dr New l'ont très bien dit tout à l'heure, de continuer à se faire donner une dose de rappel pour ceux et celles qui n'en ont pas encore reçu. Tout à l'heure, je mentionnais que c'est à peu près une augmentation d'à peu près 5 par semaine là, dans le taux de couverture d'une dose de rappel. C'est très bon, mais il faut aller plus vite parce qu'on est seulement rendu à peu près 50 Il faut se rendre certainement autour de 85, peut-être même 85 et plus. Donc, on voit là, que la vitesse n'est pas suffisante. Il faut continuer à accélérer cette administration des doses de rappel. Même chose pour les enfants. De 5 à 11 ans, on est rendu à peu près 50 aussi, mais ça augmente de juste 2 par semaine. Ce n'est pas assez vite. Il faut que nos enfants soient davantage et plus rapidement protégés. Finalement, je dirais aussi une bonne nouvelle, c'est qu'à chaque jour, on constate qu'il y a environ 10 000 personnes qui reçoivent leur première dose de vaccin. Ça, c'est une super bonne nouvelle. Il y a 10 000 Canadiens de plus par jour qui choisissent d'aller chercher une première dose de vaccin et qui vont ensuite aller chercher une deuxième dose et une dose de rappel un peu plus tard. Ce sont 10 000 personnes de plus par jour qui choisissent de se protéger eux-mêmes, qui protègent ainsi ceux qui vivent avec eux ou avec elles et qui protègent aussi nos travailleurs de la santé.
Merci. Et rapidement, suivi, le Comité national de l'immunisation.
As a follow-up, NACI is recommending a booster shot after 6 months. My question is the following. In Canada, can we expect that we'll have to have, a 6-month booster shot for the rest of the foreseeable future? Dr. New, thank you for the question. We don't know. This is something that we need to track. We're continuing to monitor the situation in a number of other countries, including, of course, Canada, based on our experience with vaccines. Vaccines are safe and effective. We know this. But protection does decrease population-wide over time. So we know it's a good idea to have booster shots at this point. What will happen in the future? We don't know, because you have to take a look at other studies and potentially other vaccines that might be adapted to these various variants. I think it's also important to raise the point that if we might be talking about booster shots here in Canada, it's not just a Canadian issue, it's worldwide. It's important to have access and to make sure that everyone the world over has access to vaccines, because it's not only about vaccinating Canadians in Canada, it's also about vaccination coverage throughout the world. Everybody is vulnerable, even specifically with respect to the emergence of new variants. If we're not prepared to offer vaccination the world over, this could be a problem.
Monsieur Duclos, vouliez-vous ajouter quelque chose, non?
Non, c'est très bien dit.
Parfait.
Merci.
Je pensais que vous vouliez prendre la parole. Donc, on va aller à une prochaine question. À ce moment-là, Dylan Robertson, Winnipeg Free Press.
Hi, thanks for taking our questions, and good morning, Minister Duclos. The Toronto Star has a report this morning on the delay in January shipment of rapid test provinces. The paper found that some Atlantic provinces got upwards of 85% of their quota, while others with much higher prevalence of active COVID have half or even 1/3 of their quota. So if your government is guided by evidence, why is your department giving rapid tests to provinces that don't need them as badly?
Well, thank you. And that's an important question. I answered, I'm sure you understood the answer, didn't answer earlier on the broader context, the 140 million rapid tests. arrived in Canada, the fact that it's represented approximately 20 times more rapid tests than the average over 2021. So I believe you have heard that answer. Now, why are the percentages to individual provinces and territories variable across Canada? Well, that depends on all sorts of things, and I'll just mention one. It depends in part on the specific demands and conditions which provinces are asking us to deliver those tests with. So just to give you an example, these rapid tests come in different packages, different types, different providers, and therefore we want as much as possible. We're obviously not perfect. We want to meet those demands and expectations of different provinces and territories, and that means that some of those rapid tests are delivered more quickly because of the size of the boxes and so on to some specific provinces and territories. But overall, we're obviously extremely mindful of the importance of treating all provinces and territories equitably. And that's why, for instance, we are now proceeding with a per capita allocation of rapid tests to provinces and territories. That was done differently in 2021. And we know that because of that, some provinces and territories got more rapid tests because they were asking more of those rapid tests. But now we believe that across Canada, all Canadians, regardless of where they live, should have access to the same availability of rapid tests wherever they may live.
Thank you. And Minister Duclos, the Southern Manitoba's Grand Chief says that Health Canada lost an order of rapid tests that the First Nations had placed with your department last September. Indigenous Services Canada says it was handled by Health Canada, and this morning they said they're still looking into my Tuesday question of what happened here. The Grand Chief said that this would never happen to a province, and he sees systemic racism here. He reordered the tests in November, and they're coming 3 months later. I'm wondering what you make of this situation.
Well, from what I hear from you, that's obviously not acceptable, and we'll therefore look into this. I understand my officials have already started to do so, but I'll make sure that the greater effort and focus is provided to that. Obviously, working with Indigenous Services Canada, Minister Aidu is not only responsible for that department, but as a former Minister of Health, she's also extremely mindful of the importance of providing Indigenous communities the support that they need, including, as you said, rapid test deliveries.
Prochaine question, Laurence Martin de Radio-Canada.
Next question from Radio-Canada. Laurent, we can't hear you. You must be on mute. Laurence, can you hear us now? Yes, we can hear you. My question is for Minister Duclos. Should we loosen public health measures at this point with all of these people being upset by the issue?
Le premier angle, c'est l'angle des décisions des provinces et des territoires qui ont chacune des conditions à la fois sanitaires et politiques variables à travers le pays, et au gouvernement canadien, et certainement moi-même, on le reconnaît. Le Canada est un grand pays, à nouveau avec différentes situations épidémiologiques, mais aussi différentes situations politiques, et c'est à chacune des provinces et des territoires de prendre les décisions que cette province ou ce territoire juge les plus appropriées dans leur contexte. La deuxième chose que j'ajouterais toutefois, c'est que, comme je disais un peu tout à l'heure, ceux qui militent contre la vaccination militent pour les confinements. Parce que la seule façon d'éviter les confinements, que ce soit au Québec ou ailleurs, c'est d'avoir des taux de vaccination élevés et accrus. C'était vrai pour le Delta. Je vais vous mentionner rapidement là, une étude qui a été produite là, par des experts de Santé Canada, une étude qu'on appelle contrefactuelle, c'est-à-dire une étude qui regarde ce qu'aurait été la situation en 2021 en l'absence de vaccination, indique à quel point la vaccination est essentielle pour éviter les confinements. On a trouvé qu'avec le variant Delta, qui était évidemment moins transmissible que le variant Omicron, avec le variant Delta, si on n'avait pas eu de vaccin, contre le variant Delta en 2021 et qu'on n'avait pas non plus mis des mesures de confinement, pas de confinement, mais des mesures de santé publique, le masque, la distanciation physique, et ainsi de suite, à partir de juillet 2021. Donc, pas de vaccination en 2021 et on arrête toutes les mesures de santé publique à partir de juillet 2021. On aurait eu 400 000 morts au Canada en date de l'automne suivant, donc en date de l'automne 2021. Évidemment, personne n'aurait pu tolérer 400 000 morts au Canada. Donc, on aurait eu besoin, en l'absence de vaccination, de mettre en place des mesures extrêmement sévères de confinement et de santé publique qui auraient nuit au climat social, qui auraient nuit évidemment énormément à l'économie. Heureusement, on a eu la vaccination pour empêcher ça. Et heureusement que maintenant, on a accès encore à de la vaccination pour nous protéger non seulement de la situation actuelle avec le Omicron, mais aussi pour nous protéger de tout autre variant qui pourra émerger au cours du temps, parce qu'on sait que la COVID-19 va continuer à nous réserver des surprises.
Laurence, un suivi?
A follow-up, Laurence. Yes, Minister, I understand there are protesters who don't believe in vaccination, but there's a large majority of Canadians who are vaccinated, and they are also tired of lockdowns. Are you prepared to do something about that? Provinces, of course, have to make decisions, but you're the federal Minister of Health. Will you be prepared to say this is going to be the last major lockdown unless there's another major wave coming that ravages the country? Are you prepared to tell Canadians that lockdowns are no longer the solution to limit the impact of the virus?
Toute bonne nouvelle doit être non seulement répétée, mais aussi entendue. Ce qu'on voit, c'est qu'au Québec, en particulier, on a atteint de toute évidence un plateau en matière d'hospitalisation. On a connu au cours des derniers jours là, une réduction d'environ 20 du nombre de personnes hospitalisées, qui est très bien. Ceci étant dit, c'est beaucoup au-delà, autour de 2600 hospitalisations au Québec, c'est beaucoup au-delà de ce que le ministre Dubé avait signalé comme étant un niveau là, acceptable un peu plus tôt en décembre. Et c'est pour ça que le gouvernement du Québec procède, comme on l'entend, là, avec prudence, mais aussi avec intelligence en matière de retrait des mesures de santé publique, y compris l'ouverture des commerces et ainsi de suite. C'est la même chose qui se passe ailleurs dans le pays. En matière d'hospitalisation, l'ouest du pays n'est pas arrivé encore à un plateau. En Manitoba, Saskatchewan, Alberta, la Colombie-Britannique, on regarde les chiffres, ils sont un petit peu là, décalés par rapport à ce qu'on a vu au Québec et en Ontario. Mais évidemment, ça va aller mieux, ça va déjà mieux dans plusieurs de ces régions que ce que c'était il y a quelques semaines à peine. Donc, on est positif, on est optimiste. On sait que les choses vont continuer d'aller mieux parce que tout d'abord, les gens font de plus en plus les bons choix, puis que la vaccination, avec l'augmentation des doses de rappel, est de plus en plus efficace.
Merci. Il n'y a plus qu'une main virtuelle.
There's only one virtual hand up. Raymond Fillon, TVA. If you have a question, please raise your hands. Anyone else? Raymond Fillon from TVA. Minister Duclos, I'd like to hear what you have to say about the occupation of the streets of Ottawa. Some people are saying that the government is counterproductive in its tone with protesters. Do you think the federal government has a role to play in freeing up the streets of Ottawa?
Bon, vous avez utilisé effectivement le bon terme. C'est maintenant une occupation, ce n'est plus une manifestation. Le premier ministre Trudeau s'est prononcé là-dessus hier, là, en observant, comme tout le monde le fait, qu'on se déplace de plus en plus vers une manifestation illégale, une occupation qui nuit énormément à la sécurité et à la qualité de vie des gens dans la grande région de Gatineau, Ottawa. Donc, on est tous là pour prendre soin les uns des autres. Les points de vue sont toujours variés. Il est important de pouvoir les exprimer aussi, ces points de vue. Mais je crois là, que les manifestants ont entendu, les occupants ont entendu le message que, oui, ce message a été entendu. Oui, on est content de l'avoir entendu, mais que maintenant, il est temps de de faire autre chose, de procéder à autre chose, de retourner chez soi, dans ses familles, et de laisser les gens de la région de Gatineau et Ottawa vivre dans la paix. Qui était demandé pour traiter de la situation. Quand on parle de manifestation illégale, d'occupation illégale, bien, ça finit par devenir lourd. Et il faut, au Canada, que la loi s'applique à tout le monde. À nouveau, c'est dans un contexte de paix, de respect, mais dans un contexte où vient un moment, comme c'est en train de se produire de toute évidence, où les occupants doivent passer à une autre étape. Leur message a été entendu. On retourne chez soi et on laisse les gens de Gatineau et d'Ottawa retrouver là, un sentiment de quiétude, de sécurité et d'harmonie pas mal plus important que celui qu'ils vivent maintenant.
Oui. Ray, un suivi?
Did you have a follow-up, Ray?
Je l'ai déjà posé.
I already asked it, but if you'll give me a chance to... Nope, no more time.
Qui vient de s'ajouter Global.
This is Rachel Gilmore from Global News.
Et non, il n'y a pas de Rachel.
Apparently there's no Rachel. So Raymond, I should have given you the floor to continue along with your questioning. Rachel, are you there?
Hey, sorry, can you hear me?
Yes.
Awesome. Thank you so much. So I had a quick question for the doctors specifically. I'm wondering if you have any advice for residents of the downtown core in Ottawa. Obviously, there are a number of individuals who speak as if they are unvaccinated. It's unclear what their vaccination status is, but they are opponents to mandatory vaccinations. Should residents of the downtown core be taking extra precautions as they navigate their daily lives with these protesters around?
I think that for the question, the first thing is, of course, follow the advice of Ottawa Public Health. They have the pulse on the ground in terms of what's going on from a public health perspective, and they would issue advice as needed. But of course, we all know the layers of protection that everybody can take depending on the epidemiology or indeed environment that people are living or working or existing in. So I think for sure, make sure everyone is well empowered to wear masks and be able to use all those layers of protection that we talk about every day to try and protect themselves. But I think if you're well vaccinated, you're wearing your mask and you're conscious of where you're moving or gathering and take extra precautions, you can certainly reduce your risk of infection. But there's still quite a high level of transmission going on right now in most parts of the country, even though the cases are coming down. So no matter where you are, I think this advice applies.
Thank you. And just for my follow-up, I was wondering if you folks have a message for your fellow healthcare workers at this time, because we have seen directives in Toronto specifically telling healthcare workers they may not want to walk to and from work in their healthcare attire, lest they become a target of those who oppose public health measures. And we've also seen reports that citizens in downtown Ottawa who try to follow the advice you just mentioned of wearing masks also find themselves harassed. So do you have any advice for A, the individuals who are being harassed for following public health advice, and B, a message for healthcare workers who might be finding this whole situation disheartening?
Yes, so I think we need to really be grateful and appreciate our health workers and our public health workers, because they've been working day and night for over 2 years to try and keep all of us safe. And it's unacceptable. Any kind of hate, any kind of violence it should not be tolerated. Protests are one thing, and it should be done as peacefully. Should be done peacefully. And these are the very people who are trying to help, not only to protect people against COVID-19, but for to support the community on all sorts of health issues. If you had an accident, if you need surgical interventions, if you need cancer treatment. So all these workers need to be able to have a safe passage to work. And I think that's critically important. I know that the minister may have something to say, of course, having policies that essentially lays out the fact that harassment of healthcare workers is completely unacceptable.
Thank you. And not only is it completely unacceptable for the reasons that Dr. Tam mentioned, but we are all aware, I believe, that the House of Commons passed and Parliament passed a law just earlier in 2021, putting severe criminal sanctions for those that are intimidating, threatening healthcare workers. We are immensely grateful to them, and we depend on them. And in fact, we're all in this together. We depend on them for the reasons that Dr. Tam said. Not only are they looking after thousands of Canadians being hospitalized because of COVID-19, but also looking after many other thousands of Canadians that every day require hospital and other healthcare services. So unacceptable and criminal. And because of that, I would invite all healthcare workers to report any such incident to their police force.
Okay, so we have a hard stop at 10:30, and I just saw Laura Osman's hand come up, so we'll go with the last one for the road. Laura?
Thank you so much for taking my question. I wanted to ask about vaccine mandates. Of course, some provinces saying they want to away with vaccine passports, for example. And a lot of people are wondering if there's any value in them left, given just how transmissible Omicron is, even for the vaccinated. And so I'm wondering if the doctors can weigh in on the value of vaccine passports at this point.
Yes, it's Teresa Tam. Maybe I'll start. We're actually looking at a whole range of public health measures and policies together with the provinces and territories, trying to get a handle from my colleagues, the chief medical officers on the ground, as to what the path forwards might be for a whole suite of these measures. I think vaccine mandates, of course, primarily are related to provincial jurisdiction. And I do think these measures should be evaluated going forwards, but for sure we're reiterating that vaccines are extremely important, particularly in reducing serious outcomes. But as I've said in my opening remarks, the protection against infection is reduced, certainly with 2 doses. It doesn't really protect you against infection, but 3 doses can certainly protect you for a period of time against infections, but really, really good protection against serious outcomes. And our ultimate goal, I think, in this country is to reduce serious outcomes and mortality, which vaccines fundamentally a foundational tool or layer of protection that I think everyone needs. So how do we make sure that we optimize and maximize vaccinations is something that is of collective interest and a topic of critical discussion right now. I think jurisdictions are in slightly different spaces in terms of their current situation. So I do think that all policies need to be re-examined over time. And this is one of them as well. But for now, of course, vaccinations are really important in our ability to manage the negative impacts of this current wave. I think what we do need to do going forwards as we emerge of the Omicron wave is to recognize that this virus is not going to disappear. And we need to be able to address the ongoing presence of the SARS-CoV-2 virus in a more sustainable way. And we need to continue, and the virus will continue to evolve. So we need to also continue to evolve our measures, recognizing that further waves will occur. Some will actually be quite severe or disruptive, and we need to be ready for them. But we do need to have more longer-term sustained approaches and capacity building so that we're not in crisis mode all the time as we fight this virus. So I think I'm looking forward to that kind of a slightly longer-term discussion with my colleagues.
Thanks so much, Dr. Tam. Go ahead, please.
If I may add very briefly, sorry to interrupt, to the wise words of Dr. Tam. The key objective of a vaccine mandate, and we do this at the federal level, is to protect individuals, protect people through vaccination. So the vaccination mandate's primary objective is to protect people when they move and work in life. It's not to punish them. Vaccine mandates are not there to punish people. They obviously create an incentive, which is a second order objective, and that incentive does indeed also work at the federal level. As we have noticed, 99% of public servants have vaccinated themselves, so they have protected themselves against the virus. So obviously they do that to protect their own health, which is the key objective, but they are also incentivized to do that through a vaccine mandate. I would end by saying that, as Dr. Tam mentioned, this is going to be an ongoing conversation, but vaccination, as we said earlier, is an incredible tool which science and scientists have given us about a year ago, which we've had the fortune of using with great success over the last year, which we know is going to continue to be an important tool as we move forward.
Thank you so much. On that note, I was hoping to ask you, Minister Duclos, as well, about travel mandates and what conversations are happening in terms of at what point can the federal government start to think about stepping that down from sort of a scientific perspective in terms of maintaining protection without inhibiting people unnecessarily?
I'm sorry, I think I missed part of your question. I apologize for asking you to repeat again.
Not at all. I'm just wondering at what point the federal government expects to start stepping down vaccine mandates for travel, given some of the things you just said and what Dr. Tam said about, the protection against transmission with 2 doses.
Well, the short answer
Well, I think we have an issue with Mr. Duclos' signal. Okay, sorry about that. Laura, you won't get your answer. Maybe Dr. Tam or Dr. New, you wish to answer about the travel mandates?
Yeah, it's Teresa Tam. So I think as with all policies, and it's actually building on my answer to the previous question, is the border measures are layers of protection. And so I think some of the abilities for us to shift those measures and indeed to facilitate travel, particularly for vaccinated individuals at the moment, is dependent on how the domestic epidemiology looks like and the healthcare capacity, as well as what's happening globally. We're monitoring that very closely. Obviously, at the domestic level, cases are beginning to come down and hospitalizations still going up in many areas. So it's quite difficult to sort of reduce those measures when that's the situation of the ability to cope with any kind of additional introduction. But at the same time, we need to begin to plan forwards for when this particular wave, recedes, and be ready. I think the whole concept is we do need to get back to some normalcy, and that includes our border measures and policies, and use the innovation and the tools that we have to try and enable safe travel. And traveling outside also depends on looking at the epidemiologic information globally. Right now, the Omicron wave is going strong. So I think that absolutely has to be reevaluated in the days and weeks to come.
It's Dr. New. The only other thing I would add is that, certainly the issue you raised is important for Canada, but I think it's also a worldwide issue. And if you look at the WHO, the World Health Organization, and the international health regulations, that's something I think that needs to be looked at, because certainly there's a balance between what we call containing public health threats, obviously in this case a global pandemic, but at the same time not unduly restricting travel and trade. And that was one of the key points that was in the international health regulations, which came out of the SARS situation many years ago. As we move forward. Thanks.
Merci, Dr. New, Dr.
Thank you, Dr. New, Dr. Tam, and Minister Duclos. This is what will close off our press conference today. Good weekend, everyone. Thank you. Good weekend. Have a good weekend.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée. Please disconnect your